Hello, ladies and gentlemen. Welcome to Mercy UMC Hospital. Mercy Hospital is about 20 acres of land. Our professional staff are saving life every day. I want to show you the main areas of our hospital campus. These are triage and isolation area. All patients that comes into our facility must go through triage. And patients with classical symptoms for highly infectious disease like COVID-19 are isolated in this compartment. And where samples are taken and sent to the district surveillance team. And from triage, the patient moves on to the patient waiting area. We are now at the patient waiting area. The patient waiting area comprises of the registrar's office, who deals with all detailed registration of our patients. And next to the registrar office, this is the consultation room and patient examination room, and we have another consultation room. Construction work is ongoing so that we can move the pharmacy from the present location to this location, and we can move the cashier from the main building to the next building, so that this can ease the movement of patients within the facility. We can reduce the patient waiting time at the hospital. These are very surgical wing, which was commissioned in January 2019. The surgical wing comprises of the top ward, male and female ward, and a big theater, which comprises of a minor theater and a main surgical theater. There are 2 offices in the surgical department. The down floor houses the finance office, the cashier's desk, the matron's office, the maternity ward, the pharmacy, and the patient observation. The matron's office, the finance officer's office, and the cashier's desk. We are trying to move the cashier's desk to the patient waiting area. The next door is the maternity ward. The maternity ward comprises of the nurse's station and the patient's bed. This other end of the top ward comprises of the female surgical ward and the pediatric surgical ward and the male surgical ward. And lastly, the administrative section of the top ward, which comprises of the outreach coordinator's desk and the statistician's desk, and we have the manager's reception. This small building houses both the clinical and research laboratories. All research concerning Sierra Leone and most of the studies done by Jala University are done at the research lab. And all clinical investigations for patient treatment are done within this small building. The building behind our main building is the additional building that houses the solar panels and the HIV and counseling units. We have 2 buildings behind the wall. This building currently houses the physical rehabilitation department. The next building is the construction work going on for the resident, for the medical doctor in charge at Mercy Hospital, and any other essential staff that may be fortunate to stay here. This will ease the movement of health workers at night to get to see their patients, and this so that we ensure we get adequate patient care for all the patients admitted at the hospital at any time of the day.